Yes.
So he's going to talk about meniscus root reconstruction, improve the results of MMPRT or over treatment. Please.
Thank you, Dr. Koka. Welcome everyone to the morning session. Okay, my name is Dr. Wachiraphan from Prince of Songkhla Nakhon University. Today, my topic is talking about the meniscus root reconstruction. So meniscus is a fibrocartilage located between femur and tibia, and its function is a transmitting and distributing load through the knee joint. Root is stay on the anterior and posterior. Loss of the roots is mean loss of the hoof state function. Loss of the root the transmitting load the meniscus cannot distributing the load. The cartilage will injury and result in osteoarthritis. So at the last part, classification divided meniscus root into 5 categories, and type 2 is the most common. Loss of completely radial tear around the root of the meniscus result in meniscus extrusion and leading to the cartilage injury and going to be the painful osteoarthritis. So nowadays about the treatment of the meniscus root tear, there is a lot of choices. High tibial osteotomy high tibial osteotomy for the patient who have the malalignment. Meniscus extrusion, just like Dr. Koka said, but the mainly for meniscus root tear is the root repair. There are a lot of suture fixation technique and suture configuration technique. But like many studies show the root repair may be not enough. From paper of the Dr. Moon, it shows repair can improve the clinical result, but cannot improve the extrusion and maybe cannot prevent the further cartilage injury. Right? From the paper, another paper that show repair compared to Meniscus and non-operative. The incidence of the osteoarthritis is still high, and rate of total knee replacement going to 33% in the repair group. Many studies from meta-analysis show cannot 100% resolve the meniscus extrusion, and the healing of the repair may be not promising, maybe at only 62% in this study. And osteoarthritis prevention, maybe 20% of the meniscus repair will progression in radiographic. Another meta-analysis show meniscus root repair can improve the post-operative clinical subjective score, but meniscus extrusion was still not reduction, and osteoarthritis will progress in the future. So meniscus root repair is by summary, meniscus root repair can improve the clinical subjective scores, but cannot 100% improve all the meniscus extrusion, or cannot 100% healing to the bone. So not totally prevent the osteoarthritis. So can we make it better? So about the repair of the root, I propose a new technique for some extent, because we don't have the a lot of study. Posterior meniscus root reconstruction. The aiming of posterior meniscus root reconstruction is the recreating the ligament-like structure that fit the meniscus root to the bone. Because the repair, we rely on the scar tissue, healing tissue, and suture material. So some paper propose the technique about use the cartilage graft to reconstruction connect the meniscus to the anatomical root insertion. Right, like paper from Dr. Ishikawa use the cartilage graft too. Better than repair, not because of fields, only to study compare the reconstruction with the repair. The first study is from the animal study. Use the pig divided into 3 groups, create the tear 1 centimeter from the root, add the control group, reconstruction root with the patellar tendon, and repair group with the suture. So in the reconstruction group, the reconstruction zone is heal well and grow firmly into the bone. The pull-out group is the repair site heal well and grow firmly to the tibial plateau. The control group is atrophy and stenosis of the meniscus. But in reconstruction group, the patellar tendon healing to the bone channel very good. In the term of the ligament protection, at the 12 weeks, we kill the pig and examine the gross appearance of the cartilage. So in the reconstruction group, the cartilage of the femur and tibial plateau is slightly worn, only the ICRS grade 1 and 2. In the repair group, is moderately worn of the cartilage and exhibit the ICRS grade 2 injury of the cartilage and severely worn in the meniscus tear. And study about the MRI, the reconstruction group can no indication of the meniscus extrusion. In the repair group, the meniscus there shows slightly extrusion of the medial meniscus, and in the control group is completely extrude. Okay, another study from so it study compared retrospective comparative about the reconstruction and repair. The mean follow-up is 26 months. Both repair and reconstruction improve the clinical score compared to the pre-operation. But when compare repair and reconstruction, the risk-home score and IKDC score in reconstruction group is quite better compared to the repair group. Asset from the MRI, the reconstruction group is complete healing, 82% is much more healing better than the repair group. About the surgical technique, it's not quite difficult. I think it's not different from the repair. So just create a tunnel at the anatomical of the root and use the suture at the 4 to 5 millimeters from the tear site and do it again at maybe 4 to 5 millimeters away from first loop and use the shutter loop for past the graft and pull it into the tibial tunnel and fix it with the interference screw close to the joint and another fixation with the suture to post. Okay. I have the MRI of the reconstruction group in reconstruction root meniscus 6 months after operation. As you see, pre-operation 5 millimeters of medial extrusion was seen, but 6 months after operation, the extrusion is gone without do anything else. And about the healing, the graft healing to the meniscus quite good and also healing into the tibial channel. Okay, I have the one case to show you. He's my neighbor. Our house is very close. He's a 55-year-old male. He is very high activity. He loves to go to the gym and exercise quite often. But unfortunately, he had both knee of the meniscus root tear. Right knee is a long time ago when I only repair, so I do the pull-out repair. But in the left knee, last year he had a left knee injury. So because he is quite young, just 55 and high up activity, so I start to reconstruction of the root. Now 9 months, I guess. 9 months after the left knee operation, he can doing everything in daily activity and still heavy exercise. He do it every time he go to the gym. And, he speak in Thai language, in Thai. So he compared to the pre-operation and post-operation improve of pain and function in both knee. But he laid the score of right knee or repair was 7 to 8 by 10 and rate his left knee nearly to normal. He rated 9. So the medial meniscus reconstruction is quite new, and it shows it can improve the clinical result as the repair, and maybe a better in the term of the meniscus reduction, and may prevent the future osteoarthritis. Maybe it's a new for me. It can be the choices for the young group with meniscus root tear, but it still need a further study of the meniscus root reconstruction. Thank you.
Okay, so the last speaker is Dr. Pattaya Swankar